Hello, I'm Dr. Steven Sparagona, and I work very closely with pediatric patients who have TSC. Now, I'd like to share my experience with you. I believe that the neurologist is coordinating care in the majority of cases. Of course, if the patient is presenting with a neurologic issue, the neurologist comes in right away. In fact, seizures are very common in TSC, so we become involved with patients early on, and in an intense way, especially for neurocognitive issues and seizures. Generally, neurologists are well versed on the disease, know the major areas to screen for, and can get the ball rolling in terms of diagnostic evaluation. Obviously, there are areas of TSC that we're less versed in, and that's when we need the help of our colleagues. If a patient presents with one of the other findings, such as cardiac rhabdomyomas, the neurologist may come in way down the pike. The same may hold true when there's a dermatological lesion. However, in my experience, when dermatologists detect a TSC-related lesion, they tend to pass the torch to the neurologist right away. For the most part, even if TSC is suspected outside the neurology realm, I'm going to see that patient pretty quickly. The specialists I work with depend on the patient's clinical presentation and what their individual problems are. I'll recommend a cardiologist if there are rhabdomyomas or cardiac rhythm disturbances, and a dermatologist if there are facial angiofibromas or ungual fibromas that may warrant treatment. Nephrologists and urologists are needed for the kidney complications of TSC, which include angiomyolipomas, renal cysts, or the rare case of renal cancer. Neurologists treating adult patients may refer to a pulmonologist to manage pulmonary complications, specifically LAM, which occurs predominantly in premenopausal women. Psychologists, psychiatrists, and the school system may also get involved if a patient has developmental issues, psychiatric problems, or autism. Ophthalmologists help TSC patients with eye disease, and neurosurgeons are needed for the management of epilepsy surgery. I may also refer patients to speech and occupational therapists.